Hi, everybody. It's Father Michael, proud to be one of the volunteers here at Audio Services for Vision Resources of Central Pennsylvania. We have a special InSight interview today, and it's going to be extremely informative. I'll tell you that right up front. We're proud and happy and honored to have with us Dr. Lauren Kaminsky, who is a board-certified allergist, immunologist, who's here today to discuss seasonal allergies. So welcome, Doctor.
Thank you for having me here today.
Oh, it's great. It's a great pleasure, and we have lots to go over, so let's get to it. First question we have. We know that there are different pollen allergies in central PA, such as tree, grass, and weed pollen allergies. But let me ask you, when do these allergies tend to be the worst?
So that's a great question. Right now, tree pollen is the worst. Trees tend to pollinate in late winter and spring, and so they tend to be the worst around March to June. But this can be affected by the winter time. So if the winter is cold and snowy, the trees tend to pollinate later. But if we have a more mild winter, we tend to see tree pollen season starting earlier, sometimes beginning of March or even into February.
So let's go to the S word, symptoms. There are different symptoms of pollen allergies, and are the symptoms of pollen allergies different for different types of pollen?
Great question. So symptoms of pollen allergies can include what we normally think of with pollen allergies: eye itching, eye redness, puffiness, nasal symptoms such as congestion, runny nose, postnasal drip, and sneezing. Then in patients with underlying lung conditions such as asthma, symptoms can also include breathing symptoms like coughing and wheezing. Some patients with pollen allergies can even get symptoms of the skin, like skin itching and hives. Hives are red, raised, itchy welts on the skin. And I've seen this in some patients with, such as grass allergy, rolling around and playing in the grass. So they have that direct exposure and then developing hives on the skin. As far as differences of symptoms for different types of pollen, these symptoms tend to vary by person. And then for each type of pollen can be the eye symptoms, the nose symptoms, skin symptoms. What we tend to see different between tree, grass, and weed pollen allergies is the timing. So tree pollen, as I had said, tends to be around March through June. Grass pollen tends to pick up a little bit later, so we see that in the summertime around May to August. And then weed pollen season, including one of the big weed pollens, ragweed, occurs later on, around August to October, November, and ends around when we have the first good frost of the season. So that could be anywhere from October to even into December, depending on when we really start to get that cold weather.
I was telling you before we started recording that this year, and I don't know why it's this year, I have these sporadic sneezing spells, and I'll walk into my residence and sit down and open up a book and immediately sneeze like a dozen times, and then it just stops. So, and I have this happen in my car and things like that. So the question I have for you, Doctor, is if pollen is everywhere outside during the pollen season, what can we do to avoid it to help improve symptoms?
Yeah, so unfortunately, during pollen season, pollen ends up being everywhere outside. It is hard to avoid, but I do make some recommendations to patients to try to help avoidance and minimize their exposure to see if that helps to improve their symptoms. So big things I've recommended to patients include keeping their windows and doors closed, including for the house and the car, during their pollen allergy season. That way the pollen stays out of the car and out of the house as best as able, so they have some space that may be pollen-free or have minimal amount of pollen. They can use air conditioners if they need to, so that way that filters the air rather than opening doors or windows to allow the fresh air in. As the other option patients can do is check pollen counts in the area for the day. So options to do this include a lot of the news outlets will provide information on pollen counts. Other options are looking at certain websites, such as the National Allergy Bureau, to see pollen counts for the area in any given day. And then avoid being outside when the pollen counts are high, especially the pollens that are affecting them. After doing any kind of yard work or playing outside, such as for kids, I recommend washing the pollen off. So showering, washing the hair, changing clothes after coming inside for the day. And that's because pollen, like we see it in the springtime with the yellow dust on the cars and all over, that can get stuck on our clothes, stuck in our hair. And changing clothes and washing can help to get rid of that. And then I also recommend drying clothes in a dryer rather than on a line outside. I do like how it smells when it's dried on a line outside, nice and fresh and clean, but hanging clothes outside can result in them collecting the pollen, and so when you put that on, you get exposed. And then for doing different outside activities, like mowing the lawn or doing yard work, it can be helpful to wear a mask or wear goggles to help protect the eyes and the nose from the pollen exposure. Unfortunately, especially when we have high pollen days, it is hard to avoid pollen completely.
So those 10,000 N95 masks that I bought during COVID will finally come in use.
Yes, that can absolutely be helpful when you're doing that yard work outside.
If you're just joining us, the voice you hear is Dr. Lauren Kaminsky. She is a board-certified allergist and immunologist who's here today to discuss seasonal allergies. We thought this would just be a very timely interview for us. Pollen is hard to completely avoid, though, right, Doctor?
Correct, yes.
Yeah, so you have to learn to live with it and deal with it. So other than trying to avoid and minimize pollen exposure, what can we do to help improve allergy symptoms?
So outside of minimization and avoidance measures, there are different medication options. Some are over the counter, some are prescribed through a healthcare provider. In general, these can include medications like oral antihistamines, different types of nasal sprays, different types of eye drops that can all be used to help symptoms and be tailored to the types of symptoms that an individual has. For this, I recommend always, for over-the-counter options, reading the package instructions for use, and then also discussing with a healthcare provider, as some of the medications can be more helpful if started early. Some medications are useful to be used whenever the symptoms are occurring. And then beyond medication options, in allergy and immunology, we have other options, including allergy shots and what we call sublingual immunotherapy. And allergy shots are vaccines in the upper arm, similar to how it sounds, allergy shots, that are given over several years to help patients who have known pollen allergies become desensitized to that or no longer have symptoms when exposed. Sublingual immunotherapy is available some places as tablets or as liquids, and it's given under the tongue, and it's also designed to help patients decrease their symptoms when exposed to these pollen allergies, and typically lasts for a couple of years. But over time, for patients I have treated with sublingual tablets or patients I've treated with allergy shots, over time they notice less symptoms when exposed to their pollen season, and the symptoms are less severe, less bothersome. So most patients I do see have good results from that.
Doctor, you're listening to Dr. Lauren Kaminsky. I grew up in New York, never had a problem with allergies or sneezing or anything at all. It was just a good time. And then I moved to Memphis, Tennessee, also no problem whatsoever. Of course, a very humid environment, climate down there. And then 40 years ago, I came to central Pennsylvania and got hit in the face with, just all sorts of allergies. So the question I have is, how do people get pollen allergies, or are we born with pollen allergies?
That is a great question. So, somewhat complicated. Allergies tend to run in families, and by that I mean different allergic conditions tend to run in families. So that can be things like pollen allergies, food allergies, asthma, eczema. So there's definitely a genetic hereditary component. But to develop pollen allergies, we also need to be exposed to the specific pollen, and this can vary a lot by where we live within the United States. So when patients move around the country, that may result in them being exposed to different pollens than their bodies saw in the past. And with that exposure over time, they can develop pollen allergies. So if they've never seen the pollen before, they're not going to have that pollen allergy.
Does that work in reverse, doctor?
So if they move from a location where they have really bad specific pollen allergies to a location where those pollens aren't present, they can have a lot of relief in their symptoms. So it can change both ways depending on which pollen allergies they have and what's present in the area that they're living.
Because my producer, Steve Long, has been trying to get me to move to Alaska for years, and I keep refusing to do it, but I think he has underlying reasons for that. Now, when someone comes to you, doctor, and says, they're having all these symptoms, what do you do to diagnose pollen allergies?
So first we talk about what kind of symptoms they're having and when they're having those symptoms to try to get a better idea of what treatment options might be best for them. And then it also helps to guide a little bit better which pollen allergies might be the most problematic for them. So if they're having symptoms mostly in the summertime, it may be more of an issue with grass pollen allergies compared to trees or weeds. After we have that discussion, there are two different ways that we can test for pollen allergies. One option that allergist immunologists are able to do in the office is what's called skin testing. And with that, we can get answers during the office visit that day and let them know what's showing up as positive pollen allergies for them. If they're on certain medications already, like antihistamines, that will affect the skin testing. And so we also have another option for diagnosis, which is through blood testing or lab work, which can be done through most labs. The unfortunate part about doing the lab testing is that the answers can take days to weeks to return once the blood is drawn, whereas with the skin testing, we can get answers that day.
Interesting. So this leads to this question. So we know about pollen. We're trying to be as educated as possible, and you've been very helpful with ways that we can cope with it. But what about other types of environmental allergies that people have?
So other than pollen allergies, there are a couple different groups of environmental allergies that patients can have. People can have allergies to molds, to animals, to cockroaches, and to dust mites, which can all cause similar symptoms. Those symptoms of eye itching and redness, runny nose, and postnasal drip, sometimes even breathing symptoms, especially if they have underlying asthma. Molds, depending on which type of mold, some are found indoors, some are found outdoors, can affect the time of the year that triggers symptoms. So indoor molds can potentially cause symptoms year-round, whereas outdoor molds tend to be more seasonal, such as molds that can grow in wet piles of wet leaves and things like that. So avoidance measures for the molds, if patients have a mold allergy, can very much depend on where that specific mold is found, whether inside or outside.
Could I ask this?
Sure.
Are there some types of indoor molds that are deadly?
So they can cause, if patients do have an allergy, they can cause these symptoms that we talked about, including breathing symptoms. So if patients do have asthma and it does trigger breathing symptoms for them, potentially that could cause more severe symptoms or affect how well their asthma and their breathing is controlled. So if they do have mold allergies and they do have that type of mold indoors, helpful things can include cleaning those areas of the house with bleach or disinfectant to get rid of the mold, and then controlling moisture in areas that tend to be the worst for mold, like basements or bathrooms, because mold typically likes moisture to be able to grow.
Interesting. I didn't mean to interrupt your train of thought. You were talking about animals, and I have to tell you, I don't think being allergic to cockroaches is a stretch. I can't imagine knowing anybody that would say, "Oh no, I love the little critters."
Yeah.
So, tell us more about the animals.
So I always talk to patients too about pets that they have at home, or animals they might be exposed to through things like hobbies, like horseback riding, or if they do any kind of farm work. Patients can have allergies to furry animals, and that can include animals like dogs, cats, horses, rabbits. I've had patients have guinea pigs as pets, and then also to different types of feathered animals, birds like chickens, parakeets. So we usually have a discussion about types of animals that they're exposed to fairly regularly. That way we can evaluate and test for potential allergies to those animals. For animal allergies, though, it can be a tough discussion. The optimal choice is really removing the animal from the house or from the location where that patient is going to be, but that is not always possible. And I can absolutely understand, especially having an animal or a pet for a very long time, removal is not an option. And so with that, I'll tend to discuss with patients other minimization tips, such as keeping the animal out of the bed, keeping the animal out of the bedroom. If they're able to wash the animal frequently to decrease the amount of allergen. And then we talk about the other options like medications and other treatments that might be helpful to them when the animal is going to be staying.
I've had a couple of guys come to me through the years, and they say they met these wonderful women and went over their house for the first time and just started sneezing because the girl had a cat, and they had to say to the girl, well, it's either going to be the cat or me, and guess who won out? So the cat always wins out.
The cat won, yeah.
The cat won, yeah. So other than what you've mentioned, I guess, seeing a doctor about that and seeing if there's something that can be done could be helpful as well, right?
Yeah, absolutely. Allergist immunologists are great at going through history and symptoms and options for further testing, and then from there, what options there are for avoidance and for treatment.
Yeah. If you just joined us, this is Father Michael, one of the volunteers here at Vision Resources, and this is one of our many InSight interviews. And today we're honored to have with us Dr. Lauren Kaminsky, who is a board-certified allergist immunologist, who's here today to discuss seasonal allergies. Doctor, before we started recording, we had a lively session in our conference room talking about food allergies. And in the few minutes that we have left in our time together today, and I certainly hope you'll come back sometime and do another interview, a follow-up one with us. What can you say about food allergies? I was fascinated in our discussion about some of the allergies that our children are exposed to these days and what's being done to help them.
Absolutely, yeah. So food allergy is a big field of research currently. And there's different types of food allergies, intolerances, and reactions. So usually with patients, I'll discuss the different types, such as the food allergy that can trigger the reaction like anaphylaxis, for which patients carry epinephrine autoinjectors. There's other types of food reactions and intolerances like celiac disease. Sometimes patients come with symptoms that they notice seem to be triggered by certain foods, and I can't necessarily explain it, but since they're noticing that repeated pattern, we'll often talk about further options for them. And with that, there's a lot of study ongoing as far as what's driving food allergies and intolerances. And because we don't fully know. And so one of the thoughts is that there's an interaction between the microbiome of the gut, so the bacteria in our gut that are interacting with our gut, interacting with our immune system, and affecting how our immune system sees these different foods when we eat them. But we don't fully understand that. One of the things that we're seeing with the anaphylaxis type of food allergies, which typically we'll see develop in younger children, is that years ago the thought was to wait to introduce these highly allergenic foods like peanut, tree nuts, milk, egg, soy, till the kids are a little bit older. But what we know now is that actually increases the risk for developing food allergies. So what we recommend now with children is introducing these allergenic foods early on, even in the 4 to 6 months when foods are starting to be introduced. If you have questions about that, I would recommend talking to the child's physician, pediatrician, or an allergist, immunologist, about food introduction.
Mm-hmm. Dr. Kaminsky, I have a friend. He and I have been friends for about 40 years, and we used to go out to lunch and dinner all the time, and he was able to eat anything and everything. And about 5 years ago, he developed celiac disease. And now, before we go out to lunch or dinner, we have to go on the internet, and he has to look to see which restaurants are offering gluten-free menus. And I'm finding that over the past 5 years, more and more restaurants are offering those items. The question I have for you, doctor, is something like celiac disease becoming more prevalent? And is anything being done to help these poor people with these symptoms? Because I got to tell you, my friend was a great eater. I mean, he really enjoyed food, and now to see him restricted, it just breaks my heart.
That's a great question. So with celiac disease, what's happening is that the body, or the immune system of the body, is responding to different proteins in wheat and causing a reaction which results in the typical symptoms of celiac disease, such as stomach upset and pain, diarrhea, can even cause vomiting. And with some patients with celiac disease, we can even see that their gut has difficulty absorbing some nutrients. And so what the recommendation is for treatment of celiac disease is gluten avoidance. There's also patients that I've seen that have noticed that with gluten, they may develop other symptoms, or they don't feel as well when they eat gluten. But with further testing, we don't find evidence of celiac disease. So there's potentially something else going on, but because they notice they feel better avoiding gluten, I usually recommend that they continue to avoid it if their symptoms improve with that. There is further studies going on as far as gluten sensitivity and what's driving this. As far as the rates of celiac disease, I'm not sure how much of an increased prevalence there is currently of celiac disease versus that us being better able to make the diagnosis either through blood testing or gastroenterology GI specialists can also do further investigation with scopes of the gut to actually look at what's going on in the tissue.
Dr. Lauren Kaminsky, I'm going to put you on the spot for the remaining couple of minutes that we have left. There's been a lot in the news about us as a country working on purifying our foods, getting rid of the additives, the dyes, and all that. As a board-certified allergist immunologist, could I have your comment on that?
Absolutely. So I was just talking to my husband about this the other night with the news showing reports of, in West Virginia now, putting out legislation to get rid of food dyes added to different foods. With the food dyes, they're often not there for any nutritional value. It's really just for the look of the food. And so with that, removing them will not change the nutritional value, which is great. And I've seen patients and families coming in with patients concerned for different types of symptoms with different foods. So some of them are more intolerances that I can't necessarily test for, and some of that is some patients find that after eating foods with certain food dyes, their kids seem to be more hyperactive or have a harder time sitting still. And so usually if they're noticing that consistent association, I'll usually recommend to them avoiding that specific food dye in the foods. But I don't have any specific testing available for that. And then with avoiding that food dye, seeing if the symptoms improve or if they have those symptoms as frequently. Other types of food dyes or food additives like annatto can trigger different types of allergic reactions in patients as well. And so that's something that we always think about when seeing patients if they've had a reaction to a certain food, really diving into what specific ingredients were in that food and what possibly could have been causing that reaction. Makes it a lot easier if it's a single food, they just had a peanut, but if they've had other types of foods like macaroni and cheese, there can be different things in there that potentially could have caused symptoms for them.
You know, Doctor, I grew up in an Italian household in New York. My mother went to the market every day. Every food she brought in the house was fresh. She washed everything. She cleaned everything. She cooked the old-fashioned way. And none of these issues were prevalent back then. I know that it's a different time and all that, but I wonder if the old ways are really the best ways. And, going back to natural, good, healthy, fresh foods, right?
Yeah, so one of the thoughts as far as why food allergies and allergic conditions in general are becoming more prevalent is what we call the hygiene hypothesis. And so with that, in previous years, kids used to play outside a lot more. Things weren't cleaned as often with Lysol and bleach constantly, so there was a little bit more exposure compared to now. So the thought is having some of that exposure, especially early on in life, may help prevent some of these allergies from developing. It's not fully clear how this works, but what we tend to see is that kids growing up on farms or around animals that are playing outside a lot more tend to have less of these food allergies and allergic conditions.
Dr. Lauren Kaminsky, thank you so much for being with us. Please come back.
Absolutely. I would love to come back and have a discussion on another topic with you.